The Health Ministry has confirmed that all four suspected coronavirus cases in the country have tested negative. According to Health Director General Datuk Dr. Noor Hisham Abdullah, the tests conducted on a suspected coronavirus patient who is being treated at an isolation ward in a hospital in Sabah found the person to be negative for the virus. In a statement, he said the patient had symptoms of influenza A and is currently recovering and in a stable condition. He said the Institute of Medical Research, IMR, confirmed that the patient is negative for the coronavirus infection. As such, he said, all four suspected coronavirus cases reported so far, comprising 2 cases in Sabah and 2 cases in Selangor, were all negative for the virus. In a statement issued earlier, Dr. Noor Hisham said the Health Ministry, through the National Crisis Preparedness and Response Centre, had received 4 reports of suspected cases of the coronavirus, namely 2 cases each in Selangor and Sabah. In another development, 8 Chinese nationals who arrived in Johor Bahru from Singapore yesterday, who have been placed under quarantine in a hotel under the supervision of the Health Ministry, have also been tested negative. Deputy Minister Dr. Lee Boon Chai said all of them were fellow travellers of the 66-year-old Chinese male national from Wuhan, who was confirmed yesterday as Singapore's first case of an individual who tested positive for the imported novel coronavirus.
They are being monitored, they are isolated in a hotel, and they will be monitored at least 1 week. They are not patients. They have been observed and see whether they develop symptom or not. Just in case they develop symptom because they have contact with the confirmed case in Singapore.
So far, those symptoms?
So far, none.
The Deputy Minister was speaking to the media after observing the arrival of a flight from Singapore at the Sultan Azlan Shah Airport in Ipoh, Perak. He also said more equipment used to measure the body temperature of travellers would be placed at all airports and other entry points into the country. In a bid to deal with the novel coronavirus outbreak effectively, the Economic Affairs Ministry is working closely with the Health Ministry through development funding to enhance national preparedness to face health emergencies and outbreaks. Economic Affairs Minister Dr. Sri Muhammad Azmin Ali said his ministry is deeply concerned that with the upcoming Chinese New Year holidays, there have been concerns over the risk of transmission with increased travel across neighbouring countries and potentially Malaysia. In a statement today, he said for this year, his ministry has allocated 227 million ringgit for the purchase of medical and non-medical equipment for all health facilities nationwide. He said his ministry will ensure that selected hospitals and health clinics identified for screening purposes will be adequately equipped. With the coronavirus continuing to spread and the Chinese government imposing travel curbs on Wuhan and 7 other cities in the country, the virus outbreak is likely to affect the Visit Malaysia 2020 VM 2020 campaign. Research House Kenanga said the immediate concern is that the virus may spread fast, helped by the heightened travelling activities during the Lunar New Year, with the impact on tourist arrivals from China and elsewhere enough to affect VM 2020. In its research note today, Kenanga said such a situation would affect the economy to a certain extent, at least in the first half of 2020. It said similar to the SARS virus outbreak in 2003, the Malaysian government is expected to take preemptive fiscal and monetary measures to support the tourism as well as the retail and transport sectors, as the impact would risk a wider fiscal deficit and higher debt ratio to gross domestic product, GDP. Kenanga added that barring a full-blown epidemic or a death toll increase at an alarming rate, it is maintaining its forecast of 4.3% for this year, compared with the official 2020 forecast of 4.8%. In 2003, the SARS outbreak seeped into the economy mainly through the confidence and demand channels, with the adverse impact materializing in late March and lasting until end May, after which it gradually abated. The research house said that the economy expanded at a softer pace, registering a six-quarter low purely due to the services sector, specifically a sharp fall in the wholesale and retail trade, as well as the hotels and restaurant subsectors. Kananga said tourism activities tapered, with tourist arrivals charting a downtrend for 2 straight quarters and remaining on a downtrend up until 2005. Meanwhile, continuing with the story on the virus, China broadened its unprecedented open-ended lockdowns to encompass Hubei province on Friday, as the government scrambles to contain the deadly coronavirus that has so far killed at least 25 people and sickened about 830 others. The lockdowns come as the locals travel across the country for the Lunar New Year holiday, bringing the number affected by the shutdown to about 32 million people. At least 6 cities were also added to the list of places under lockdown, all in Hubei province, where the illness originated. This brings the number of cities covered in the lockdown order to 10. Local transportation, including buses, trains, subways and taxis in the cities of Qibi, Xiantao, Xijiang, Qianjiang, Xianying, Huangxi and Enqi have suspended their services, with all public venues in these cities having also shut down except hospitals, supermarkets, farmers markets, petrol stations and drugstores. As of today, the virus has spread to at least 9 countries, including Thailand, Japan, South Korea, Hong Kong, Taiwan, Macau, and the United States. Meanwhile, the city of Wuhan, epicenter of the outbreak, is building a dedicated hospital with 1,000 beds to treat patients, which it aims to complete in 6 days. Building machinery, including 35 diggers and 10 bulldozers, arrived at the site on Thursday night with the aim to get the new facility ready by Monday. Wuhan, a city of 11 million people, has also sought more financial assistance from the central government. Hospitals in the center of the city have also called on public support for protective supplies such as masks and suits, as supplies run low and the number of cases grows daily. With the number of confirmed cases rising by the hundreds every day, medical supplies in the city were in short supply as people flood into hospitals waiting to be treated. The virus was believed to have originated in a market which traded in illegal wildlife. Preliminary research suggested that in the most recent stage of its evolution, the Wuhan virus was passed on to humans from snakes. And a little closer to home, Singapore has confirmed 2 more cases of the new strain of coronavirus earlier today, taking the tally to 3 cases. Singaporean Health Ministry officials confirmed this just a day after identifying its first case of the infection that originated from China. The patient is reported to have been isolated and warded in the Singapore General Hospital, and officials have already begun contact tracing. Authorities have identified 9 close contacts and will follow up with quarantine procedures for all cases. The patient's son has also contracted the illness, and doctors are treating him as a suspect case while proceeding to test the boy from time to time. The ministry also expected more imported cases because of the high travel volume from China, especially during this holiday period. In another development, the World Health Organization (WHO) said on Thursday that it was too early to declare the outbreak of the novel coronavirus in China a public health emergency of international concern, also known as a PHEIC.
Make no mistake, this is, though, an emergency in China. But it has not yet become a global health emergency.
He added that the WHO's risk assessment concluded that the outbreak is a very high risk in China and a high risk regionally and globally. The WHO chief also reiterated that the fact that he's not declaring a PHEIC should not be taken as a sign that the WHO does not think the situation is serious or that they are not taking it seriously. The PHEIC is defined by the WHO as an extraordinary event that is determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. Although human-to-human transmission is detected in China, for now it appears limited to family groups and health workers caring for the infected patients. Thus, for the moment, the WHO does not recommend any broader restrictions on travel or trade and recommends exit screening at airports as part of a comprehensive set of containment measures. All countries should have in place measures to detect cases of coronavirus, including at health facilities.